good 6 or 7. Okay, that lady, will you say who you are, where you're from, and what the question is?
Okay, I'm Jules from Welsh Government. My question is for Adrian.
Hi. Jo Stevens, Welsh Government, and my question's for Adrian. You talked about prevention being a better intervention, better way to go, and I wondered if you knew of any organisations that were good at that.
Thank you. Hello? I feel like a dodgy cabaret singer. No. It's a short answer. I think a lot of people are doing some really good work, but again, the evidence to evaluate it isn't out yet. Just thinking. I guess if you think about the NHS, NHS Wales, for one idea, it's not one system, so you've got organisational divisions between different systems, but even within there, so my health board and I in Birmingham, roughly 14,000 people, but probably over 1,000, maybe even more subsystems. So what I would say is there is evidence within those systems of good practice, and you get variability. So I often say to people, you can get something as small as a small team thriving because the conditions are right, and usually because the management style is right, whether by accident or design. And they could be exemplars of good practice, but when you generalise that, it doesn't generalise because it's not consistently or strategically developed. And I guess that's the next stage, I think, is trying to systematically and strategically build in these conditions to create healthier workplaces preventatively. But we're not there. I think we're about 10 years behind. So because it's often rests on culture. And we also have to think about the cultural pull from target-driven cultures. So there's multiple angles to consider, but it's possible.
Do you have anything else to comment on
I think from our perspective, in terms of engaging with Minds products and services, Companies House have stood out as a really good employer. And when they completed the Workplace Wellbeing Index last year, they achieved goal, which is achieving excellence. So there are times to change Wales pledged employer. The assessment criteria for the index includes policy and practice review, raising awareness around mental health, senior leadership buy-in, training staff and line managers. So yeah, they came out as a really good employee example of good practice.
I'd just like to add to that really that Health Wales have also signed up to be Time to Change Employer very recently, and really good senior buy-in on that. Our chief exec really engaged in it, our chair. So yeah, things have definitely improved at our employer as well.
Well, I'd like to say something about that, and to amplify that. Although we talk about prevention in the workplace, actually, we're not talking about prevention in general. If it were prevention in general, it would be Public Health Wales. Parliamentary review looked at what Public Health Wales was doing and congratulated on the prevention approach it had been taking in the past few years. But you're not talking about that. It is highly regrettable that it took me at least 8 years when I returned to Wales to get the then Welsh Government to recognise that work was one of the major issues that had to be addressed in Wales. It was all left to the Department for Work and Pensions, where I was working some of the time. Only recently has this employment focus been raised, and that's because of it being raised by Public Health Wales when I was there, and has been now addressed to some effect. But it's still a lack of recognition of how important work is to well-being, and how important work is to tackling the poverty that I mentioned earlier, and the social inequality, and the health inequalities in our country. So, but there are people, for example, there are evidence bases in Glasgow University, Ian MacDonald being in charge of that. In Cambridge, Ian Brown was doing work on prevention in the work, looking at prevention of illness in the workplace, and it includes mental health problems. Honda I visited Honda when I was in London, and I've been back to them several times. They have an excellent system for looking at, seeking out and identifying those factors which precipitate or prolong or promote mental health distress in the workplace, and they've got systems for addressing that. And they also have abandoned one thing that was to look at whether people had resilience against mental health when they were being appointed. That was appalling, and many companies still have a little tinge of that, but practically that's gone. And last of all, Royal Mail. Royal Mail, as I mentioned earlier, has now got a system, although it's changed slightly in its status to Royal Mail, good evidence base for prevention of ill health and of mental health and of presenteeism in the workplace. And I can get lots some more. Next question, please. Yes. Say who you are and where you're from.
Hi, my name is Adele Talia. I'm a retired midwife from an Aylward University Health Board. My question is to the panel really. I retired with ill health last year, and it wasn't the best experience, working in the public sector. And my question to the panel really is, are there any plans, is there more scope for services to work more closely together, occupational health and particularly HR, so they work closely together around the mental health agenda for employees? I think, joined up working would be a big step forward in helping people, and I don't know what your thoughts are or what the plans are.
Can you say what you said at the beginning, because I didn't catch that?
Sorry, Adele Battaglia, I'm a retired midwife from an Aylward University Health
The
Board.
next bit when
I
you
retired
You
with
retired.
ill health last year after 33 years in the NHS. So you would hope that you would go on a really positive experience, but not to slate or disrespect any colleagues, but I just think lessons could be learnt as a better way forward for people in the future.
Adrian, do you like to? Yeah, just try it. It's good physical exercise.
Hi, Adele, I know each other. Lovely to see you. Are there any plans? I don't know. Should there be plans? Absolutely. I guess if we go back to one of the slides, if you shift to a preventative focus, if you just consider for a moment the aspect of fairness and justice and equity in how we do business, I think we get that wrong so very often. And I guess the corporate drivers to deliver well, we're not quite sure what some of the corporate drivers are, but they're often not aligned with staff experience. And we know that the staff experience from the moment they're employed to the end of their relationship with that employer is crucial. It's not a process of engage now, engage later. It is an ongoing relationship, and I think that is, if it's not managed, it's a waste. I was doing some work last night at, I won't give details, but a small ward. Some staff have experienced a pretty difficult experience, which in its own right is an unusual experience, so merits a normal reaction of distress, but of course we don't quite know what to do with that, so I get called. That was 6 weeks ago. I came in for a follow-up session with them. Their emotional state had changed from what I would say would be a normal reaction to a really distressing experience to a different emotional state as a result of the investigation process they're all caught up in. Completely avoidable. Out of 6 people, 2 of them were saying, I don't think I want to work here anymore. One is saying, I've changed my relationship with my work, I'm hyper-vigilant, I check everything now, I'm defensively practicing, I don't enjoy it. That to me is avoidable. So I suspect there's some resonance there, Adele. There's a lot of just how we do business we can change, and we can make it much safer and healthier for people.
I think I touched on this quite a bit in my presentation, but 2009, I'm not sure if, I'm looking at Malcolm again, I'm not sure if you knew, as you were employing me, all that was going on in the background with occupational health at all. No, I didn't think so. So for me, it really made me think that, am I going to be allowed to go and work here, first of all? Because I didn't know if the two were interacting. I think it's got better over the years. Thankfully, I haven't tested the system very recently to know, but definitely occupational health and HR need to work better together if they're not already. Definitely, it's just common sense to me. I don't know if there's anything else.
I'd say something. I always do. I'm sorry to hog the microphone, but you must read the parliamentary review. One of the main points made in the parliamentary review was there must be revolution from within. And one of the major recommendations, which has been gladly accepted by, well, Welsh Government has accepted all recommendations, but the one that is paramount is we must have a seamless, boundaryless health and care system, which includes the elements that you've been talking about. Occupational health is also mentioned. It's imperative and calls for new models of care, and that care means not just within the hospital system, but across the community, and moving that hospital centre thinking to the community where these things can be best addressed. When we did the parliamentary interviews for parliamentary review, it was quite evident that what you were saying was repeated and repeated again and again. Not just in the area of occupational health and HR, but across the system. And that must change. Last question.
Hi, I'm Karen Roberts. I manage the Time to Change Wales campaign. My question is mainly for you, Adrian. There's been several references to evaluation and research and statistics and things. And as we go into phase 3, one of the things that we've been asked to look at is the impact that our intervention has within organisations. I'm just interested in knowing what your thoughts are about how we capture the actual outcomes of what we do, not just the outputs, because employers are quite willing to share statistics around absenteeism and those sorts of things. But what I'm really interested in is the actual, effect that we've had and the improvement and the behaviour change and all those sorts of things. And if you've got any ideas really about how we go about evaluating that in phase 3.
Brilliant, thank you. I guess measuring impact is a nightmare, really, isn't it? I think it all depends what you prioritise. So what's your output? What is your intended output? And I would design your measurements around the intended output. So, and I guess there will be different priorities, won't there? So some people will have a priority around sickness absence. Now, in my eyes, sickness absence is actually quite a crude measure. So it doesn't really tell you a lot other than are people in work. And often how we measure that is, you don't really get a sense of what is going on. So my advice would be to sit down and determine what outcomes would be desirable and to measure against that. So if you're saying, okay, well, we know well-being is important, but what does that really mean? Because it's a bit of a nebulous area. I would encourage you to think, okay, what experience, if staff had a certain experience, and that would correlate with the outcomes you want, how would that look? So, I guess, do people feel safe? Do people feel valued? Do people feel listened to or heard? So those are simple things in some respects, but very powerful because they're predictive. So I would strip it down to what conditions you really want to support at stage 3, and then design a methodology around measuring that. So I would do mixed methods. I would speak to people, but right across the system, because you find there are often blockages down, and the less power you have, the more those issues will become really important. So within my system, our healthcare support workers and our facility staff very rarely get a look in, but are the biggest group. So I would be quite strategic in asking specific questions around those themes, but target the different strata of your organisation. Hope that helps.
Can I just ask you something?
from a project's perspective and what we're trying to achieve. But actually, it's all continuing this if we haven't got the buy-in of the specific employer that we work with. And there's absolutely not one size that fits all.
I mean, we charge with working with, public, private sector, SMEs even maybe have 3 or 4 employers, and naturally, they're going to want to have their own outcomes and outputs within that framework. Should the responsibility, do you think, or, playing devil's advocate here, be on the employer to collate that information or to track it? And I mean, because for me, beyond our days, we obviously want it to be sustainable and we want the employer to take a hold of it and run with it and the action plans and the pledge and all those sorts of things. We haven't got the resources to chase them every 6 months to say, are you doing this, are you doing... Do you see what I'm saying? So I'm trying to think of a way of building in that evaluation into the offer that we, is part of a sort of two-way process, and if you like.
Thank you. It's really good to hear that you want to essentially talk about legacy, aren't you? You want something meaningful, you want to embed it, you want it to thrive. I mean, I've worked with SMEs as well, and actually quite enjoyed it, because often the much smaller systems are much easier to navigate, and you have a much clearer sense of how important it is to that organisation. I guess the issue is some people will say it's really important, but then as soon as the door closes when you're gone, that ceases to become an organisational priority. I think that for me, the link is relevance, is how do you make it relevant for them so they hold on to it, because things live or die by the relevance, don't they? Motivation is determined by how relevant it is to you and how doable is it. So I'd use those 2 principles, but if you can find the thread of relevance for them that has some permanence, so one would say, okay, HSC used that framework for protecting people's physical health, because they take people to court, and the laws. That makes it relevant. We don't have that level of protection or motivation. So what else is there? So we've got the parliamentary review and guidelines for NHS organisations. So that builds relevance, but you've got to get deeper. So what I've been doing is trying to tie, and it might sound a bit politically kind of dodgy, but I've been trying to tie well-being around other desirable organisational outcomes like productivity, errors, if you want to push it, mortality rates, sustainability of staffing, turnover, and don't think about absence as a priority, but you talk that language and it becomes more relevant, and doors open.
And for reference, for you to look at is the Handbook of Return to Work by Springer Elsevier, published in 2016. It's a huge volume, but highly prized. The standard reference book, and there are chapters there by experts on outcome measurements in mental health, in other types of health, in looking at what they call presenteeism, being both illness at work and continue to work. And I think that's where the number of references in those chapters to the last 8 years, as recent as 2016, are really well worth looking for. And if you can't, well, you should find the book, because it's selling thousands. So there we go. So that's that. Now then, Malcolm.
Yeah. Just right.
We're okay. We're actually now only... Oh, I thought we were behind. Oh, yeah.